The small town engagement model, which is what we call our STEM model, is where we work with communities that are generally less than 1,000 people in population, and we work with those communities where there might be an existing allied health provider or someone in the health arena that's in these towns that's happy to host a GP or another allied health and work together as a multidisciplinary team and provide a service to a smaller community that wouldn't have had a service. So our first example of a small town engagement model is our Spring Ridge Health Hub.
I'm the first GP in this community in 30 years. I'm enjoying it. They're a great community and they need care just like my urban population needs care. Some of the challenges that we GPs face in rural areas as opposed to urban areas are quite unique. I would say the primary concern is the tyranny of distance. It's the distance from colleagues, it's the distance for patients to specialist care. It is those challenges that lead to delayed care and compromised health as a result.
Working in a remote area, obviously we'd see a lot less volume of patients compared to the city or urban areas, but the good thing about that is that we have a really close relationship with most of our customers.
We're able to actually facilitate the meetings between the pharmacist and the GP. We're able to provide them with a small grant to get this established. We're able to provide them with some assistance in marketing and promoting the service, and we're able to facilitate the conversations to actually get the program up and running.
Technology is at the heart of what I'm doing. It allows us to breach that tyranny of distance. Telehealth can do a lot to actually deliver a high level of care to people when they need it, where they need it.
Since the doctor has been here and people have been able to access him through telehealth, the convenience of doing that have meant that they will ring a doctor about an ailment that they might not have otherwise worried about.
I can operate remotely wherever I go. The telehealth aspect, the video is very seamless. I've actually not had any consults that have failed so far. From a productivity point of view, it allows efficiency at the farmer's end or the rural community's end. From a GP's point of view, it allows me to reach into communities that otherwise would be unreached.
Since e-scripts have started and people can get it sent straight to the phone, it's really streamlined the process for us. As well as the convenience for patients. If a prescription is required, you can then come straight to the pharmacy and get that. If you've had a telehealth and you can't actually get to the pharmacy, we're more than happy to dispense it and then send it on the mail run.
The Primary Health Network is going to expand the STEM model, so we'll be putting out an expression of interest in 2024 to encourage communities to think about partnering with the Primary Health Network, to think about their existing workforce and to think about what service gaps that they've got in their town that they need addressing and what they have, what we can enhance and work on together. Primary healthcare providers in small rural towns are encouraged to reach out to the Primary Health Network to discuss their interests.